Good morning, everyone. Many of you may already know me. I'm Laura Fernandez-Diaz. I work at the Members and Partners Development Team here at UICC. And I'm very excited to welcome you to our kitchen here at UICC offices. And I am very pleased to introduce Janine, who is recently joined UICC at the comms team. And she's the face and force behind World Cancer Day now. So welcome, Janine.
Hi, thank you, Laura, for this lovely introduction. And good morning, everyone, from wherever you are joining today in the world. And welcome to the launch of the new theme of the World Cancer Day. I'm so excited and so thrilled to be part of this global community. And I know that I inherited such a powerful legacy. And yeah, I'm just thrilled that I am here and I get to be part of this adventure.
Absolutely. Well, Janine, we've been doing a lot of work in the previous years, and I'm just going to show you like a few of the excellent results. For example, obviously all working together with our community, and the results have been incredible. We registered 840 activities from 116 countries. We have been trending on Twitter on World Cancer Day for the past 2 years. We counted almost 700,000 social media posts, which is it's quite a lot. And we illuminated, and here I do a drum roll because it's absolutely incredible, 152 landmarks in orange all over the world, and the list just goes on.
This is really impressive. And it brings to me a lot of hope, which is what World Cancer is all about. It's about bringing hope. It's about raising awareness. It's about expressing your solidarity with all those who have or are touched by cancer in one way or another. Because this is really the day when we are in it together and we feel it. We're together in this.
Absolutely. And I think we've all been waiting up until today to see what the campaign is going to look like. So can you tell us maybe what's the tagline?
Right.
Or some?
Yes, of course. This is a really exciting moment for UICC because for the next 3 years, we will be addressing the issue of inequities in cancer care. And the tagline is, close the care gap.
Yay!
Yeah.
It looks great, Janine. Yeah. And why are we talking about this?
Well, you know, Laura, the reality today is that who you are and where you live could really mean the difference between life and death. And while there has been great progress in cancer care in the last 20-30 years, a lot of people are still missing out. And that is just really not okay and it's unfair. And we can do something about it. And we should do something about it.
Yeah, I think it is clearly all about equity. And, I think that the best person that can actually talk about the direction that the campaign is taking is our CEO, Kerry Adams. And I think we have a video message from him that we will play now. So over to you, Kerry.
My name is Kerry Adams, and I'm the CEO of the Union for International Cancer Control, based here in Geneva, Switzerland. We're the team behind World Cancer Day every year. And as we approach February the 4th, we have a new theme and a new campaign for 3 years, Close the Care Gap. We have seen over the last 20 months the challenges that people have had to get treatment and care, with screenings being cancelled and people being hesitant about going into a treatment centre to have their treatment for their cancer. And cancer organisations have responded brilliantly by supporting those patients through their journey, despite all of the difficulties that they have faced. It's also created a lot of innovation, and we've seen organisations reach out to patients in new ways online to support them. We've seen advances in diagnostics and remote delivery of the treatment and the care. So there has been some silver linings. However, what it has revealed is the deep inequities which exist in society, which stop many getting the treatment that they need and they deserve. So there's lots to be done. So join us on World Cancer Day and raise the issue of equity around the world. Let's close the care gap and let's start on World Cancer Day. Every action that you take will make a difference, and make sure you let us know beforehand what your plans are for February the 4th. Go to the website, worldcancerday.org, look at the toolkits, download the posters, tell us what you're doing and put your event on the map of events. We want to know what you'll be doing. And if you're doing something on social media, remember to use the hashtags World Cancer Day and hashtag Close the Care Gap. I look forward to hearing everything you'll be doing for World Cancer Day. It'll be a tremendous year. Let's remember, let's address inequities around the world. Thank you.
Well, thank you so much, Carrie. It really is an exciting new direction for UICC, for World Cancer Day and UICC. And it makes a lot of sense because equity is clearly the red thread in all the work that we are doing. It just shows that just recently we had the World Cancer Leaders Summit, and it was dedicated entirely to this topic. So it really resonates with our community. But Janine, perhaps you can tell us now a little bit more about how the campaign is going to be rolled out over the next 3 years.
Yeah, with pleasure, Laura. So, only when you know about a problem, when you understand it, can you really care about it and then do something about it. And this is what we're going to do in 2022. It's about realizing the problem. It's about understanding and recognizing the inequities in cancer care around the globe. And it's really about, going into this with an open mind, challenging your own assumptions and looking at the hard facts.
Absolutely, because we know that equity in cancer care costs lives. It's just as clear as that. And that people who seek cancer care, they hit barriers at every turn. And those barriers, they can be from income, education, location, as you said, where you live. In some cases, discrimination based on ethnicity, age, gender, sexual orientation. I mean, these are just a few of the factors that can negatively affect care. And basically, Janine, the gap affects everyone.
Yeah, exactly. And that is why we want to hear from everyone. We want to hear from you, our global community, from our supporters, partners, and members about what inequities in cancer you are facing, what is important in your area, and that, we just really want to hear from you. Mm-hmm. We want to learn.
Yes. And tell me a little bit more about 2023 and 2024, the following years of the campaign.
Right. So in 2023, it's about uniting our voices and taking action. So we will join with like-minded people, and because we know that we are stronger when we're in this together, when we work together. Mm-hmm. We will celebrate real-world progress in its many forms, and this will fuel our momentum to fight these injustices. And we will mobilize our friends, our families, our co-workers, and communities, because we know we're stronger. We're in this together.
Mm-hmm. Absolutely.
And then in 2024, which is the last year of the campaign, it's really about taking it to the higher level. Mm. We want together challenge those who are in power. We want them to really address the root causes of these inequities. Because now that we have the knowledge, now that we have the community behind us, it's really time to shake the very foundations of these injustices and, really push for lasting change.
Mm-hmm. It's a very powerful message, Janine. I'm loving it, and I'm sure our members from all our regions, they will be very, very keen to get involved.
I really hope so, Laura. And I think now would be the perfect moment, actually, to ask one of our members what cancer inequity looks like in their context, in their region. Mm-hmm. Just to hear their story and how they will use World Cancer Day. Do you have someone in mind?
I think I do, actually. I'm thinking of Dr. Hadi from the Qatar Cancer Society, that I'm sure he will be very happy to share his insights. He's been so involved so far. He's a member of the advisory group as well, and a very engaged member of UICC. So maybe we can call him.
Yeah, let's call him. That sounds like a great idea. Hi, Dr. Hadi. Good morning.
Good morning, guys. How are you? I just put it on the Facebook Live that I want to be with you. Thank you so much for having me today.
It's our pleasure, Dr. Hadi. Thank you so much.
Thank you so much. Good morning to all UICC team members and to all the great UICC team and the member of the network. Good morning, good evening, good night, you never know. UICC you guys now you reach how many countries and members you guys reach? You reach everywhere.
72 countries, yes, with 1,000 members. So really, it is a big, as you said, we have a big group. And World Cancer Day goes beyond because, it's for everyone. So
soon you're gonna you reach another planet, different time zone. You guys.
Launching.
Great. Yes.
Talking about launching, I think it will be really, really interesting to hear what does the closer care gap mean to you personally? How do you relate to the closer care gap campaign?
Yeah, it's one of the most lessons we learned from the pandemic. This is one of the biggest lessons learned from pandemic. Going through the pandemic, we start to be have more understanding that we really need to close the the gap in the social determinant of health, the environmental determinant of health, that all impact the gap in the care, in the cancer care. So it's something very important in my own health belief. You know, every person working in healthcare area, they have their own health belief. This is something very important, very dear to my heart. As a, let's say, as a person with health background, the other aspect, as a person, I'm from Syria, and unfortunately Syria going through this difficult times. And one of the important thing is the gap in cancer care in for people living with cancer in conflict zone. And that's topic is very important, and we need to put emphasis and effort for this. And UICC already has been starting doing effort in this, starting, I mean, since 2018. You guys remember face-to-face Congress? You remember those days in Malaysia?
Yeah.
It was a great session. I mean, and hopefully soon we'll be coming back to face-to-face sessions and network with UICC members.
Mm-hmm.
Dr. Hadi, I was wondering also, is inequity in cancer and health in general, is that an important topic in the Gulf region?
It's actually of highly importance for the Gulf region, because as maybe not everyone on this call aware of this, GCC is Gulf region is culture melting pot. We have variety of nationality, variety of culture that people come to the Gulf region to reach their dream, to work, to study, even now in Qatar or the region, having people to come and get treated in the healthcare institution or study here in the Gulf region. And having those variety of culture and belief, so that will lead to the importance of focusing on equity to maintain the access to all and prevent gap before it's happening.
Absolutely, it really, as we were saying, it resonates at so many levels. It really is. I think what we will want to hear before you leave, Dr. Hadi, is what is the Qatar Cancer Society planning to do in World Cancer Day? You are such an engaged organization with the World Cancer Day campaign so far. So give us some ideas, perhaps, as to what other organizations can do.
Yeah. So actually, we'll first start with the first point that Janine mentioned, spreading the awareness about the concept of equity and closing the care gap. This topic is very important, to take it from bottom up and top down approach. So we're going to start with the public, and also we're going to start with the policymaker to improve their awareness about the concept of equity and closing the care gap. In addition to that, we're going to do and we'll hope to add more and more lightning landscape in the state of Qatar. And hopefully we'll collaborate with the whole GCC region. That will be great. And what's else? The last year, when in the time of the COVID, we had this drive-through cinema with the motorcycle rally. This year, we're going to make another rally of motorcycle and cars. As next year, we'll be having the World Cup here in Doha, and I hope that you guys all come. We will be planning for having a soccer competition, football competition, to increase the awareness. And I think maybe more in the pipeline, social media competition. But we'll see. I mean, we'll learn also from other members in the UICC. So please, as a member, share your ideas so we could have this collaborative work in all members. And as they say, let's close the care gap.
Yes, let's close the care gap. That's really interesting, Dr. Hadi. Thank you so much.
These are really exciting ideas. I look forward to following what you're really doing then on 4th of February. But I think we have come to an end of our Q&A with you, Dr. Hadi. So thank you very much for joining us. And I'm sure I'll see you very soon in Zoom at some point.
Thank you so much. Take care.
Bye-bye.
It really is always so great to hear from our members. They are really the force behind this whole movement. They make it come to life, and they engage incredibly with the campaign. So thank you for that.
I think that's absolutely right. And I think now would be a great moment also to show our members what we have specifically planned for this campaign in terms of materials and activities. What do you think?
Oh, let's do that.
Absolutely. Right. So first thing is first, all the information on World Cancer Day can be found on the website, its dedicated website, which is worldcancerday.org. Mm-hmm. This is where you can find all information related to the campaign, cancer in general as well, campaign materials, activities, and ideas on how to get involved.
Amazing. Can we look in more detail perhaps how our viewers can get involved this year?
Yeah, let's look at some of the activities. So, for example, we have the 21-day challenge, which is focused exclusively on inequity. If you want to learn about cancer inequities in a super easy and digestible way, you can subscribe to the 21 Days for Impact Challenge, Close the Care Gap. You can also test your knowledge by completing the equity quiz. Both of these activities can be found under the Take Action tab of the website.
That sounds like a really fun way to learn about such a complex issue, Janine. And so tell me, what else can you do?
Right. So, you know, the main focus for next World Cancer Day is all about learning about the cancer inequities. So, of course, for this, we need to listen and want to listen to the perspectives from different people from all over the regions. So please share your stories and let us know what cancer inequities you're facing and which ones resonate the most with you. You can do this by going on the website and click Take Action, and then share your story and fill in the form to be featured on the World Cancer Day website.
Well, that is incredible. I can't wait to see and read some of those stories. So really encourage people to do so. And what about materials? What materials are available for members and supporters?
Yeah, of course. We have plenty of content ready to use for our supporters and our members. And to find these, you just have to click on materials on the website, and then there's the library. You will find how-to guides, World Cancer Day, and Close the Care Gap logo. So you can make your own mugs like we did. And you can find the social media banners, infographics, the action toolkit, and campaign posters.
Incredible. And I see that this, it looks to be in English only. Is there any other language available?
Well, for now, they're mostly available in English only, but we do aim to have all the material translated and available, hopefully by the end of this month. And the additional languages we're working on are Spanish, Brazilian Portuguese, French, Russian, Arabic, Chinese, and German. And if you would like to help with the translation into the other languages that we didn't mention just now, please send us a message at hello@worldcancerday.org.
That's amazing, Janine. Like all those languages, I think that will be very well received by our community. I just have a question, considering like what we were doing last year, for instance. What's happening with the Solidarity Challenge?
Well, of course, we don't want to. I'm really excited to announce that we are going to have a second edition of the Solidarity Challenge with our partner Orson. Mm-hmm. And for those of you who don't know what the Solidarity Challenge is, it is a virtual race on Swift, the platform Swift, bringing together over 60,000 cyclists and some of the top names in sports and entertainment to raise awareness and funds. And celebrities that we already have confirmed are Sir Mo Farah, D'Angelo Williams, and Paula Radcliffe. So make sure you stay tuned and you stay tuned for the broadcast on the 4th of February.
Live on the 4th of February. That's incredible with all these celebrities again. Like it's really very exciting.
Yes, I'm really excited.
I'm thinking that maybe now it's a good time to maybe hear from people that have joined us live today. So well.
Are there some questions?
Hello, everyone. Hi. Again, thank you for joining us. I don't know if we have any questions from the audience. Oh, so I see our friend Sepide from Mahak is asking for, well, I'm not sure actually. She's in Mahak. Anyway, from Iran. So hello to. We actually rely a lot on our supporters and our members to provide us with some help, because I guess we can't do everything, right, Janine?
We cannot ourselves translate into Farsi, but of course, if you would like to help us, we would be happy to then make the material available in Farsi as well.
Mm-hmm. Yes. Oh, thank you. Yeah,
that's great. Thank you.
We can always count on Mahak. I think they are also on our advisory group at World Cancer Day Advisory Group, which I want to take the opportunity to say thank you again for this very engaged group of members of the UICC that are really helping us through with
definitely
work.
We wouldn't be here without your advice, so it's really great to have you on board.
Absolutely. I don't know if we have more questions. It seems that what I would like to say again is to take the opportunity to say thank you and to encourage everyone that may not be watching live but may be watching later to to really take note of all the missing materials and all the toolkits and everything that is available on the website, as you said. So yeah, this is always fantastic.
I think we have come to an end of our Facebook Live, more or less. But before we go, I want to also thank you again for joining us, and also a thank you to our current and past partners. We hope that you will use this material and make this campaign your own. But you know, Laura, before we go, I do have a little surprise for our viewers.
Oh, that sounds excellent.
Yeah, I wouldn't leave you just like that. So you will be the first audience to see the first public viewing of our World Cancer Day video.
Wow. Well, in that case, I think I'm just going to say goodbye to everyone. Again, a big thank you. I don't want to take any more time because the video, I'm sure that is absolutely wonderful. So thank you, everyone. And this is me. Bye-bye.
Thank you. And the video will play right here and right now.
Young and old, rich and poor, black, white, and every color, male, female, trans, and other, the right and the left, east and west, followers, leaders, believers, and none, everyone. Far more unites us than divides us. So let's all agree, the people and the powers that be, to make the world aware we need to close the gap in cancer care.